Okay, the time is now 3:31. I'd like to call the meeting of the Human Services Committee to order. Please note this meeting is being transmitted live via video stream. You can find a link to the video stream by visiting the Orange County website at www.orangecountygov.com, clicking on the tab Legislator and locating the Human Services meeting on the calendar. Please be sure to silence all of your cell phones and tablets and other electronic devices. And be mindful that the microphones in the statutory committee room are very sensitive and robust. So if we could please rise for a moment of silent reflection and the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Okay, roll call, please, Marie.
Emo.
Here.
Anagnostakis.
Present.
Ellers. Ramos.
Present.
Patel. Tui.
Here.
Sutherland.
Here.
5 present, 2 absent.
Okay. Great, thank you. First on the agenda, we have Steve Knopf, Director of Employment and Training, here to give us an update on the December job fair and something else that's going on, maybe the spring job fair, whatever you have.
Sure, job fair. We have a lot. Most recent, large one, we had the Newburgh Mall, that was in October. 107 employers, and we figured we had about 450 job seekers, which was pleasantly surprising. The one we had at the gallery in the spring, I don't know, we had over 100 employers, but job seekers probably under 300. So that's good. I think things going in the right direction. COVID winding down, obviously, people are getting more back in the workforce than they were. The numbers show that workforce participation is up a little bit, not a lot, but it's not where it was pre-pandemic, but it is above. What is it now? I wrote down a note. It is above 62%, 62.3%, which is very good. Pandemic, it was in the 50s. I don't know if we'll get to the 70s again, but that's just based on the baby boomers exiting the job market. But yeah, things are looking good. Still ton of people unemployed. Employed. Unemployed, 1,200, I think, are collecting UI right now. That's, I don't know, I've never seen it that low in my life. You know, it's below 2.6% was our unemployment rate in November. Yeah, Orange County, that's Hudson Valley was 2.5, the state was 3.8. We're 2.6. That's unheard of. I don't know if it's ever been that low. So lots of jobs, not too many job seekers. But our career centers are open, seeing people in person. We'll see them virtually over the phone. If you do need help, come see us. We are retraining quite a few folks in some high demand occupations. A lot of people in the medical field, phlebotomists, EKG, medical assistants, certified nursing assistants, not so much. Those are the folks that we want to get into the nursing homes, but there doesn't seem to be a big demand for that. Not sure why. As I know, the nursing homes are struggling getting staff. I know Valley View is struggling, as you all know. But all the long-term care facilities are struggling to get staff. It is becoming quite a problem. CDL drivers, we've trained a number of those folks. That's high demand occupation, so that's a good thing, helping the supply chain moving along. But all things considered, we're optimistic. We've got another job fair on Thursday at Kaplan Hall in the SUNY Orange building.
This Thursday?
This Thursday, yes. 3 to 6. We have 25 employers coming to that one. Again, a lot in the medical profession, long-term care facilities. I think Crystal One will be there, Garnett. there's a high demand there in that sector, in the healthcare sector. There's quite a bit of frustration on their end in trying to fill those positions.
But and what time is that at? I'm sorry.
3 in the afternoon until 6 in the evening.
Legislator Tui?
Yeah, Steve, with the 26 employees, did you say that that's made, it's only a medical one, a medical job fair?
No, primarily, it's mostly the medical.
What drew it up to 107 versus?
Because we were in the Newburgh Mall.
You're in the-
We're only in Capitol at the SUNY Yards, that's all we can fit. Well, we have the Newburgh Mall, that's our large fall job fair, we have the gallery, we can handle over 100 employers.
Yeah,
We have a waiting list for the one at Capitol. We try to do one a month in whether it's Port Jervis, Middletown, or Newburgh, we try to alternate. We try to have in our career centers, but we've got such a demand, can't fit that many employers, so SUNY Orange is more than happy to help us out.
and when was the one in the Newburgh Mall?
End of October.
Okay. That's where the new casino is.
That is correct, yes. And they were out the door. They had a booth there because they're just about to open up. Folks were out the door lining up for jobs there.
Yeah.
We did an event for them in the spring in our Newburgh Career Center. They had a table at Illuminate Newburgh, is that what it's called, right? I believe. Newburgh Illuminated. So they promoted this event that they were going to have at our career center about job openings and opportunities. We had over 200 people converge on our career center that day. I couldn't believe it. So
Do you have any more dates lined up for the Newburgh Mall? It sounds like that's a hot spot.
we'll do it in the fall. But we'll do the Middletown Gallery in the spring, and then we'll go back to we've done that for the last 10 or 15 years. We do spring in the gallery over here in Middletown, and then Newburgh Mall in the fall.
And what kind of employee participation do you get?
That runs the
gallery?
gamut. They're all pretty much the same employers.
What about the same number, 100 or so?
Yeah. In the last few years, since the economy's kind of, flip-flopped,
Yeah.
there are more job openings than job seekers.
Thank you, Chairman.
If you want to go back to 2008, we had a job fair at the Galleria. There were 48 employers, and there were 2,500 job seekers. So that just shows you over since 2008, 2009, where we've come as far as it's a good thing. Wages are up, opportunity, that's good, but there definitely is a crunch on bodies right now. And,
Do you have a
you
date
can't make
on
them.
this
Well,
spring?
You can, but another 18 years before you're a little guy or girl is ready to get out there and work.
Do you have a date for the spring job fair?
Not yet, no. May at some point, but I'll let you all know when that happens.
And what does somebody have to do in order to get on that list of employers?
Just contact our office. We've got a working list of about 350, 400 employers that we reach out to regularly. But if, someone is interested, we add them to the list and reach out to them.
Is there a form, or I had a constituent that wanted to get into the October one that wasn't able to reach anybody, so.
Oh, really? Because, no, there's on our website, there is a number to contact. I should know if there's a form. I don't believe so, but we have one person who takes all the information, gets, if they want a table, gets tabled $75 per employer. Yeah, just, Jen, they can just contact me, if they want to participate in the spring one. Yeah, in the spring ones. But also we would probably, so we're in January, probably in March, we would have a small one in Newburgh again. So if
Okay.
it's a Newburgh, I don't know if it's a Newburgh employer, Middletown employer.
Middletown.
Middletown. So probably in February, we will probably have one at our Middletown Career Center if they wanted to participate in that. We just don't get the amount of people to attend that. We don't do a mass marketing thing. It's more email blasts with the Labor Department of folks who are on unemployment insurance, through a welfare to work program, folks who are collecting public assistance who are deemed employable. That's kind of who we try to target.
Okay, great, thank you. Legislator Thomas, you have a question?
Thank you, Madam Chair. Do you have a flyer for the event this Thursday that you could email to our legislative clerk for us to
Absolutely.
distribute?
Yes.
Something
I
that's
believe it
shared
is on our
like
website as well, but I will
Facebook
double
or
check.
social
Absolutely.
media? Thank you.
You got
Anybody else have any questions?
Thank you, Madam Chair.
it.
Okay, thank you so much.
Great, thanks,
Yeah,
guys,
look forward
appreciate
to that
it.
email.
Good seeing you all. Have a great afternoon.
Yeah.
Okay, and next up, we have Commissioner Miller from Social Services and Mental Health for her monthly report.
Good afternoon, everyone. Happy New Year.
Happy New Year to you.
So we move from employment right on
There we
to our cash assistance, temporary assistance, family assistance. As you see, slight rise, coming close to the final month of statistics for 2022. That will be, next month we'll get that, but we did see an increase in our safety net caseload by 14.5%, which was 92 new cases, and 1% in family assistance, which is 5 cases. And down below, you see the numbers of participation and welfare to work program is my colleague was just speaking about. Those numbers are nowhere near where they were pre-pandemic because our caseload is so small, right? And then when your caseload is small, you have a number of people on the caseload that are exempt for whatever reason, medical reason, health reason, substance use. So, we'll see those numbers increase over time as we've been watching for. SNAP continues to be a challenge for us. We're working very hard. We had 232 average weekly applications over the past few weeks. And we still have staff working from other units at SNAP. We have all staff working overtime. We're really working hard to catch up on those applications and really help people get those benefits in place. We were just notified that the COVID emergency supplement will be going away in March. So people, a family of 4, for example, whose income may have made them eligible for half of the total allotment of SNAP, during the COVID emergency experience, they've gotten the full max amount of SNAP benefit. And they've also gotten a supplemental benefit of $95 a month. So say your benefit was, $500, you may only be getting $250 and you'll be losing the $95 benefit. So we know that that is going to negatively impact families across Orange County. We'll continue to monitor, as we have at your request at county executives and our own initiative, to be sure that pantries have what they need, that families are able to reach out and get those supports, that we are adding. Currently, the Food Bank of the Hudson Valley is still working with the last appropriation of funds that we gave them. So, we will monitor very closely for that, but we anticipate there's going to be a lot of concern. You may even get complaint calls from families who will be struggling. But they will be going back to the pre-COVID SNAP benefit amounts.
How are the pantries right now around the county area?
We haven't heard that they're not doing well. So yes, as far as we know, they're doing well. The additional benefit that we gave allowed them to get additional supplies. And if there's anything otherwise, and they also know to let us know if they have concerns. And the food bank also was in regular contact with Irene, so they should let them know too. So.
Yes. Oh, I'm sorry.
Have you notified the food banks and the small food pantries of this change, that they can anticipate an increase?
No, we will. That's a good suggestion. I also, New York State Public Welfare Association has requested from New York State OTDA that they consider putting their own hotline number up so that they can help to screen some of these calls. As you know, our call center is getting an average of 1,200 calls a day. The number of calls that could come in as a result of this, we're very worried about the workload. So they've also asked if they would directly communicate with consumers, sending them notifications, sending them a letter so that they can prepare for it. So we haven't heard back from that request yet, but I'm hoping they'll accommodate.
And are the smaller food pantries, have they been notified of the additional benefits that are available to them through the Hudson Valley Food Bank from what we've provided?
If they received their product from the Food Bank of the Hudson Valley, then they would know. In their relation, most of them do across the county, but if you know one that doesn't, some do just have donations that they use.
Yeah, I know several smaller ones who tapped into the food bank during like the pandemic and the height of it, and I know a lot of them that still have very high numbers. And I don't know that they're necessarily aware of that funding that's available there to help them supplement what they're getting from their donations.
We'll double check to be sure that the messaging is getting out.
I'm thinking more of the small parish ones. Thank you. Thank you, Madam Chair.
Good afternoon, Ramos. Thank you. How is the monitoring done with the pantries to ensure that they are aware of these changes and that they are, supplied to a good level based on demand?
We don't directly monitor food banks, pantries, but we, 8 years ago, went into a contract with the Food Bank of the Hudson Valley as a supplier for many of the pantries. So that knowing that that would be the best place to put our funds, because you get $10 a product for every dollar you invest, and they have relationships. As you see, if you go to their website, they have about 35 pantries across Orange County that are connected with them. So it was a way for us to, in county government, to make a connection and a link with the pantries, but we don't have a direct communication with them. During the pandemic, we did have an emergency response committee that was coming together, and they continue to meet, I think it's every 6 months, just as check in and make sure everything's okay. But what we really hope we've designed is, if you have a problem, let somebody know. Because we'll help to address it. And typically they'll come in, the message will come in through one of you, will come in through the county exec's office, will come in directly to us, or it may be the food bank that's sending the message to us. So in that sense, it's not really our role to monitor what they do, but we have asked them to give us information so we can have a sense of how many meals are going out.
Thank you.
Yeah, Darcy, with the, you said 1,200 calls per day,
Correct, yes.
and is that the 311 number?
No. 311 number gets about 1,200 calls per week, if you want to put that into perspective. But the our call center at Department of Social Services gets that many calls a day, just asking questions about heat and snacks.
Okay, thanks.
Peak, go strong. We're cold out today, but yeah, they're processing applications. Then we have the per diem staff in, they all work overtime. Our leader, I think she puts 70 hours in a week, while we're in the midst of heat season. Emergency housing placements, going back to pre-pandemic numbers. We do have, New York State has required that single females be housed separately in shelters than families, and Honor has always housed them together. So they will be making a change. Ecclesia House over in Newburgh houses about 10 women, and they will likely all move over to a new location within Honor Shelter, because we'll need to staff that women's portion of the shelter. So they will now have a single male family and a single female. We'll also, by moving the females out, will allow them to expand the number of families that they can serve at Honor, maybe even increase the number of single females that they'll be able to house there too. So it is a positive move, although it is a shift. And then they and their board will decide if they do something different with Ecclesia House. We did have a couple suggestions. We'll see what they decide to do with that. But that is a change that is coming forward. I'm hopeful for the future as far as affordable housing and some of the changes. I know many of you may have listened to the governor's State of the State. And, if we're successful at being able to create 800,000 new housing units, and if the, 2,500 mental health units are separate from those, and there's some positive things that could be coming down the road that can address some of these housing challenges.
I'm sorry.
Just while we're, just step back for a heat.
Sure, I'm sorry, yes.
November for 2022-23. November was the first month that it was open.
Yes,
And I know that was kind of mild back then, but with that type of volume calling up heat, you must be expecting a big jump in December and January. Even though it's been mild still, but still, you can't live, it's 55 degrees in your house.
we're not sure. Obviously, when you have the spike in IT, we had a reporter call and ask some of these questions, and so we put a graph together. I could have brought that for you. You probably would have found it interesting. I could send it to you, though. I'll send it out so you can all take a look at it. But it shows the trending over time in a different graph style with a stable line. So you see where we had the spike that came in. And when you have a spike like that, when you're first open, you do get really nervous. Will it balance out? We don't know. We think because of the economy, because of the cost of fuel, it likely won't. We'll probably come in with more applications this year than we've had in previous years.
And they did raise the threshold, the income threshold somewhat.
We raised the threshold when you all added the additional funds. Excuse me, for the fuel fund.
Yeah.
We did raise that threshold, yes.
For the fuel fund.
Correct,
But
yes.
what about for the heat?
No, that heap is set. It's set by the federal government. And yeah, we didn't touch that threshold.
And if you notice, in the previous years, prior to last year, November is a high month followed by a relatively lower December. And last year, the HEAP unit had a special program where they were paying some back cost of utilities. And so that's also what caused for such a steep growth in that program last year.
Yes,
Next time.
that's very true. All right. Let's look forward to the housing side. Medicaid numbers, 133,411. We did get notified that continuous coverage will be ending at the end of February. So we have instructions for how we will move forward with assessing cases. End of March.
Well, but it'll end up being in June when the cases actually start coming.
When we start doing the recertification. So you have then following that, they promised we have 60 days or 90 days following that to begin to process. So what that means is anybody who went on Medicaid during the pandemic or who was on Medicaid during the pandemic had continuous coverage up until the end date that has been established. So as of June, we who manage a small portion of the total cases and the state who manages a larger portion will need to evaluate whether people are still eligible for Medicaid and do a whole recertification process. In that process, the cases that are not eligible will close. So that it's a big undertaking, and I think that the state, we probably have what's actually, so 22,000 that we're managing. Yeah, and they're managing the rest, so it will be a lot of work to get that caught up. And they have 1 year from that point, or they will start getting penalized by the federal government not to meet that. So I'm sure they're working diligently to come up with a plan, as are we. Child protected numbers, continue being stable, no big surprises there. We are embarking on a new project, not a new project, but a reinforced project. We've had co-location of fearless domestic violence advocates in our child welfare for, maybe a decade now. And they use a model called Safe and Together model. It's a best practice intervention for child welfare and domestic violence working together. Because it's been so many years since we have the training, we have so many new staff, and there's new staff at Fearless. New York State Office of Children and Family Services is promoting this model in other counties who don't have co-location or don't use this model. They're going to come back to Orange County and reinforce the training. We've committed, Fearless is committed, but our staff are all going to be trained. It's going to strengthen the work that we do. So many of our cases that get called into the child abuse hotline involve domestic violence, the complexity of that situation. We all need to be prepared to handle it appropriately. And I think this is a great opportunity. And I'm glad that they're willing to come back in and do that training for our staff.
And that's called Safer Together.
Safe and Together.
Yes.
No surprises on this page either with our raise the age statistics. We have implemented our raise the lower age, which I indicated in previous meetings, went into effect in December of 29th of last year. So we will see how that, those numbers of referrals go and how that programming addresses those. Foster care numbers down just a little bit. I have a sense that unless we discharged a number of children, we're going to see those numbers go up a little bit. More going on, unfortunately, in our community, but we'll keep an eye on those numbers. Adult protective. Do we have the new chart
No,
in here?
that's just it's gonna be in the beginning of the next year when we make the change.
We're just gonna add a new graph on here for you with adult protective services, so it allows you to see ongoing caseload as well as new cases. I think that'll help you to see the whole picture, and particularly of the increase for our adult protective staff in guardianship cases and in investigation cases. As the population grows of our aging population, for sure, we have seen those numbers increase. So we'll look forward to showing you another view of the work that they're doing. Home care numbers stay pretty stable. And child support. We talked before about why they collected a bit under, trying to sort out, some of the changes. They also, they just did a job as they typically do, and that's in collaboration, as you know, with the county sheriff's office. Correctional investigation, we'll see some pickup in that as we, as continuous coverage changes, Medicaid will go back into the mix, at least those cases that we manage. We may see some increase over time with that. Oh, I wanted to add another thing to your thinking. Medicaid spend out has changed, and believe me, you don't want to know all the details of that, but the amount of resource that people can have in the bank and the spend down criteria has changed. So people who had to contribute towards their Medicaid to keep their coverage will no longer have that spend down. Well, that spend down calculates towards expense that allows for eligibility for SNAP. So they won't have to pay the spend down, but it could reduce their SNAP benefit. So just another reduction potentially in SNAP.
Anybody else have any questions?
A lot of reductions.
Yes,
Well, thank you.
Thank you.
Very much for your report and for being here. If we could just have during the minutes reflect that legislator Todd Tell is here. And I want to welcome legislator Ramos to Human Services.
Yeah.
Look forward to having you here as we move forward. And what an honor it is to be able to sit here with all of you and chair the committee again. So thank you so much. The motion to adjourn?
Second.
Okay, all in favor?
Aye.
Aye. Okay, thank you so much.